Notify the public that this meeting is being recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. And with that, I'm going to throw it over to the Board Secretary, Ducia, to open the meeting.
Thank you very much, Kristen.
Can I just ask everybody to mute, please?
Okay, thank you very much, Kristen. My name is Ducia Lebovskaya, or Ducia Alpha Short, and I'm going to start with my introduction, and then I'll follow the first person that I see on the screen. So I am today co-chairing, and I am on the board, and I live in Boston, in Mission Hill specifically, and I will go I'll go maybe back to Kristen McCosh, who I see at the top of the screen, please.
Okay, I'll throw it to Carl. And Carl, after you introduce yourself, would you be able to mute your line?
Yep. This is Carl Richardson. I'm from Brighton.
Kyle?
Kyle Robidoux. I live in Lower Roxbury.
Paul?
Paul Karen, I live in the West End, Beacon Hill area.
And Alice?
Alice Fisher, I live in the South End.
I think that's all the board members that are on right now.
Yes.
Hi.
Oh, I'm sorry, Wesley.
Hi, this is Wes. I'm here.
Sorry, you were hiding down in the corner.
That's all right. This is Wesley Ireland. I'm a board member here, and I live in the North End.
I'm also here. This is Juan Ramirez, commission member. I also live in the Boston South End.
Yeah, that looks like, so we have all the board members. Should we go there to approve of the minutes?
The minutes are not ready yet for last month, so I will email them out to you probably next week, so we can go to the next agenda item.
All right. Okay, then the next on the agenda is then a presentation by the City Department, a presentation by City Department of Rebecca Fu. I hope I'm pronouncing your name correctly. License, and from the Alexis Isaac from the Mayor's Office. Thank you very much. Rebecca Fu.
Hi, everyone. Thank you for having us. As Ducia said, I am here with Alexis from the Mayor's Office. She's actually going to start us off. Alexis?
Hi, everyone. My name is Alexis Isaac. Very happy to be here. I'm going to share some slides, and we will go through a presentation. Okay, can everyone see the slides?
Yeah.
Yes, Rebecca, are you able to?
No. Oh, yep, now I can.
Okay, wonderful. So yes, hi again, everyone. My name is Alexis Isaac. I work in the Mayor's Office, and I've been helping support the various departments that have helped put on the outdoor dining program. So Rebecca and I are here to just share a little bit of information about the outdoor dining program, and to leave some time for questions as well. So as I mentioned, today's presentation, we will give some background and context on outdoor dining, We will provide an overview of the 2020 and 2021 outdoor dining seasons, and we'll share a little bit more details on how we ensured accessible outdoor dining patios for these seasons. Also, please feel free to stop me at any point if I'm moving through the slides too fast or talking too fast. I tend to speak quickly sometimes. So this slide has a lot of text, but we just wanted to highlight the importance of restaurants and outdoor dining. Restaurants are really important for economic recovery from the pandemic. Restaurants are a major employer in the city of Boston with about 65,900 accommodation and food service jobs and over 2,000 restaurants in the city. Restaurants were also one of the most impacted by the pandemic, and there were about 28% of employees in this sector filing for unemployment insurance as of fall 2020, which was the highest of any sector. Restaurants are also important for equity in reopening. Restaurants employ many of the most economically at-risk residents. For example, 65.4% of employees in the sector make less than 300% of the poverty line. Also, 67% of restaurant workers in Boston are women, and a big part of the racial unemployment gap can be explained by the overrepresentation of Black and Latino workers in low-paying jobs in the service sector. So it's really important to get restaurants back to have equitable reopening. And lastly, as many likely know, restaurants are also just a very important part of vibrancy, joy, and reconnection in the city. And outdoor dining helps amplify that vibrancy and reconnection. They're a place that people can reconnect among friends, family, and neighbors. And they're also an opportunity to reflect the cherished cultures and foods of Boston's diverse communities. Even though there are all of these benefits and importance of restaurants, there's also challenges that come with outdoor dining. And traditionally in Boston, there have been several barriers. So for one, it was a lengthy process in the past. It took 4 to 6 months to get approval for outdoor dining on public property, and applicants needed to appear in person for several hearings along the way. It was also a highly technical process. The application required an engineer stamped site plan drawing, and also typically required restaurant owners to have a lawyer based on certain documents required in the application. As a result, it was very expensive. It typically costs $5,000 to $10,000 for application fees and some of the materials that are needed in the first year in particular. And lastly, there was limited accessibility in the past, which included architectural barriers for persons with disabilities. So for example, locating tables on the street involves a 3 to 6 inch level change from the curb to the street, which introduces a barrier. There are not many areas in the city that have wide enough sidewalks to accommodate dining, because we want to make sure that if we're placing tables on the sidewalk, there's enough space for pedestrians and persons in wheelchairs, et cetera, to move freely on the sidewalk. And lastly, surfaces may not be smooth and level, especially in certain areas of the city, which makes it harder to have patio setups and harder for people to move around. So given some of these barriers, as a response to the COVID pandemic, the 2020 temporary outdoor dining program was created, and there were a few goals in mind. So one was to support outdoor dining as a safe and accessible way to bring vibrancy to the streets, to support local restaurants, and to provide an enjoyable experience for restaurant goers. There's also a goal to increase participation in outdoor dining by aiming to remove some of the barriers that were previously mentioned. And lastly, make outdoor dining more equitable and accessible. So we wanted it to be a far easier opportunity to far more restaurants and far more neighborhoods so that more people could benefit from the program. So I'm going to pass it to to Rebecca to just talk a little bit about what went into building the 2020 and 2021 programs.
Thank you, Alexis. So to successfully assist restaurants with the outdoor dining process, we formed an interdepartmental team to create and run the program last year in May. On this slide, you'll see logos of these city departments that are part of our outdoor dining team, which includes the licensing board, which I'm part of, economic development, the transportation department, the Public Improvement Commission, or PIC, and of course the Disabilities Commission, as well as other departments. Next slide, please. As part of the application, we wanted to ensure accessibility for persons with disabilities. The Disabilities Commission reviewed, they were a primary reviewer in these applications to ensure compliance with ADA guidelines. So requests on public property such as sidewalks, the reviewer would check site plans and photos that were submitted to see if the applicant provided enough clearance on the public way for handicaps, people with strollers, and etc. And on street setups, they would check for the appropriate portable ramps, and for parklet designs, they would check if the decks were level or flush with the sidewalk. In addition, the reviewer for the Public Improvement Commission would also set conditions for approvals that would align with the ADA rules and guidelines. The screenshot that is on the slide is a portion of our online application where we collected data related to accessibility. Next slide, please. On the next two slides, we have an overview of the 2020 dining program as well as the 2021 dining. The governor announced outdoor dining as part of phase 2, which began last year in June. Our program ended in December. We approved over 550 restaurants across the city, and 50% were minority, immigrant, and women or veteran owned. And the Disability Commission provided 88 portable ramps to restaurant owners who needed them. Next slide, please. Oh, you already did. And here we have a similar snapshot for 2021. We started the season earlier in April, and it's expected to end in December this year. We had over 475 restaurants approved so far, and this year we were able to provide 160 portable ramps to restaurant owners. Next slide. And on this slide, we have some examples of the patio setup. On the left, you see a portable ramp between the sidewalk and the street. In the middle, we have a built deck that is level with the sidewalk for easier access. And then on the right, it's just another portable ramp. And I will now pass it back to Alexis, who will speak about the AAB variants, accessibility support offered by the city, and enforcement of the patios.
Thank you, Rebecca. So again, a lot of text here, but just wanted to provide some context on the work that the Disabilities Commission team did for the AAB variants. So when the state of emergency happened last summer, the Disabilities Commission recognized the need for accessible passive travel so that people with disabilities could get from the sidewalk down to the new dining areas on the street. The city applied for an architectural access board variance to ensure that access and accommodations were provided across the city. Some details on the approved variance include that it will be in place throughout the Massachusetts state of emergency, which is currently set to end on June 15th, 2021. The team is currently submitting an amendment to hopefully extend that variance through December 31st, 2021, so that it can last throughout the whole 2021 season. This variance includes outdoor dining that extends into any public way or public park, and it requires restaurants to post accessibility information on their websites so that people can know ahead of time what restaurants are accessible and what that looks like. Portable ramps that help assist people from the sidewalk to the street must feature a safety lip on each side for stability. And accessibility toolkits have been provided to restaurant owners that include highly visible signage that they must display outside of their establishment. And that signage also has an on-site contact for from the restaurant, and as well as the commission's contact information if anyone does want to reach out to anyone. The information has also been provided to restaurant owners on accessible tables and seating requirements. So every restaurant is required to have to meet those minimum seating requirements for accessibility. And the Disability Commission is working with restaurant owners around what best practices are for serving and communicating with customers who have disabilities. So this just highlights some of the work related to accessibility. And we also wanted to provide an overview of the support offered related to accessibility. So primarily, as Rebecca mentioned, portable ramps were offered for free to restaurant owners to ensure that outdoor dining across the city would be accessible. The commission began lending out ramps in June 2020 after the AAB variance was received. As mentioned, the city also gave out accessibility toolkits that provided instructions on how to set up the ramps properly. Through grant funding, the commission was able to procure and distribute 160 portable ramps, and 67 of these went to restaurants that identified as minority, immigrant, woman, or veteran owned. And, including those ramps and ramps that went to small neighborhood restaurants as well. Ongoing work of the commission is to continue providing technical assistance and support to owners who have additional questions about access for customers with disabilities. So the team, is consistently responding to requests and helping support that work. Just wanted to end here with a little bit about how we're ensuring continued accessibility after the initial review. So, once the patios have been set up, we have continued to monitor concerns and complaints that we receive to ensure that there's adherence to the accessibility guidelines and requirements. After the application is approved, restaurants are required to submit a photo of their patio and their setup. So the team reviews those photos, and if we see that a setup does not match the approved setup, for example, if there's no space for a ramp or if there's not enough width on the sidewalk, a member of the licensing board, typically Rebecca, or a member of the Disabilities Commission follows up with that restaurant owner in an email and asking them to fix the setup. And we also ask them to submit a photo once the issue has been rectified so that we can confirm that the patio is now accessible. In addition to this photo, we also receive complaints and concerns through directly through the Disabilities Commission, through the Boston 311 hotline, and also to the 2021 outdoordining@boston.gov email. If a complaint is received through any of these channels, the team investigates and follows up with that restaurant to ensure that the issue is remedied so that we can maintain accessibility. So that is it for our presentation. Thank you for listening, and we are very happy to answer any questions you might have.
Can you unmute me for a minute? Ducia, do you want to call on people who may have questions?
Yes, sure. Yes, thank you. Yes, anybody, I don't see right now anybody who has question, but I just go, Carl, do you have any questions? No? Alice?
Wesley does.
Fisher?
I think Wesley has a question.
Sorry? Oh, Wesley? Okay, sure.
Sure, I have a comment, question, kind of a mix of both, and a follow-up question as well with my comment. So I actually live in the North End, and there's a lot of restaurants here, as you may know, in the North End, especially on Hanover Street. as well as Salem Street. And there are so many restaurants, within the area, and they're using patio space on the street for outdoor dining. And from what I've noticed, some of them don't have any ramps, so they're not accessible. And it's up on a sidewalk, so there's a little bit of a bump that you have to go over to access the restaurant. And because the North End is a very popular place for people to go and for tourists to visit, I'm always concerned and thinking about the pedestrians and the pedestrian traffic that's occurring in the area. Sometimes it's out of control. There are so many people in that area. So my concern here is there anything that your department can do to address this issue of too much pedestrian traffic?
I can start with that, and then maybe Rebecca or a team if you want to add. But yeah, I think that's a really important concern, and definitely one that we've heard and that the team is concerned about. I think we've been trying to balance allowing as many restaurants and supporting as many restaurants as possible through giving access to this program. But I think especially as we look ahead to what outdoor dining might look like in the future, that we really, really want to be focused on those types of issues and have that inform any future plans. And, we're not quite sure what that might look like in other years, but the North End is definitely a neighborhood that has come up as being maybe a little bit too dense in terms of restaurants to have as many patios as we're seeing. And I think that's something the team is considering, of whether we should have some criteria to limit the number of patios given the concerns that you raised. I do think, and maybe someone from the commission team could answer this more directly, but the ramps that are required are portable ramps. So each of those restaurants should have a ramp available to get folks down from the sidewalk to the street. And that's a part of their site plan. They have to designate where that ramp would be placed. So, maybe that's some work that our team can do to follow up to make sure each of the restaurants have that, but they should have that available when needed.
Hi. Great, thank you so much. And again, another factor that I'm thinking about with the sidewalks, they're pretty small and narrow. So just another issue there. But I am happy that the restaurants have been successful through this program, so that's good. But thank you so much for answering my question.
So I'd like to throw it over to my architectural team if they'd like to give any input on this, because they've worked very hard on this program. My suspicion is that just what Alexis said, that they have the ramps, they're just not set up. But in that case, they should still be displaying signage. So Patricia, I don't know if you want to make a comment?
Yeah, hi everyone, this is Patricia, can you hear me? Great. So Wellesley, we have been handing out the portable ramps. So the restaurants are going to get the ramp and put them down when somebody requests them. And then they're allowed to pick them up and put them away. So that could be a reason why you don't see them there. And we have been focusing on keeping the sidewalk clear, keeping 4 feet, and the really wide sidewalks, we've been trying to keep 8 feet. So we're all paying attention to those issues this year because of the pandemic. We really want to support, like the team said, support the restaurants. But we want to really continue to prioritize that pedestrians are a priority and that they're safe and they have space to live on Transverse and use the sidewalk as a priority.
Sarah, did you want to add anything?
Just a small
asterisk to Patricia's comment. We, as much as possible, like to keep 5 feet, aligning with our Boston Complete Streets guideline, which is a guidebook that we've had for a while and been using as a standard, so that allows two people to pass each other in the street comfortably. So as much as possible, we like to stick to that dimension. But again, it depends on where the sidewalk is and how many pedestrians there are. Yeah, I think that's all I have to add.
Thank you, Sarah. You're right. It's 5 feet. I misspoke.
And then Ducia, you can ask if any more board members or members of the public have questions. Looks like Carl.
Yes. Yes, Carl, please unmute yourself. Oh, you're muted. Oh no, you're still muted. Still.
Carl, you're on mute. Try it again.
Carl, you're still muted.
Yes. Can you hear me?
Paul, we can hear you. I know Carl had it. Carl, I don't know, maybe Carl should maybe,
We can come back to Carl. Yeah, see if
yeah,
anyone
okay.
has questions.
Sure. Yeah, Paul, feel free to step forward.
Okay. Can you hear me?
Yes?
Okay. I had a question on obtaining a ramp for some of the smaller restaurants in the area. Do you go through will we go through the commission, or do we go through the licensing commission?
Patricia, could you respond to that?
We work closely together. I think you go through the licensing commission.
Okay. Thank you.
Yes, either I just wanted to add, either way, if you contact the commission or the outdoor dining team, we will connect you to the Disabilities Commission to make sure those ramps are get out to the restaurants that need them.
Thank you.
Looks like you're off mute, but we couldn't hear you.
Hello, can you hear me now?
Yep.
Okay, sorry about that. I didn't have the screen on. I didn't mute myself initially, and then, so my question is this: when the state of emergency is over and the variance request is over, it's going to be hard to tell restaurants they can no longer have outdoor seating once that's become a feature. And if so, how are we going to go back to the accessibility we once had where we had access to the whole sidewalk? Have we thought about, a year from now, what happens when things go back to normal?
So I guess that's the $1 million question, Carl, because so many policies have been put in place during COVID, and we know they're not all gonna last after the state of emergency ends. So we're gonna work really closely with BTD and Public Works and licensing and neighborhood services to come up with the best plan for each neighborhood. It probably will differ depending on, like Sarah said, the width of the sidewalk, the busy foot traffic on the street, but we will work very closely with other city departments and with community members to make sure that we provide an accessible, safe space for restaurants to work in. But just realize too that these were emergency measures that we put into place. So we still want to give the restaurants some time to recoup some revenue and support their businesses, but we will be looking at the big picture moving forward for sure. Alexis, did you have anything to add to that?
No, that was perfect. Definitely we'll be working with many departments to try to see what plan makes sense moving forward.
Thank you.
I had a quick question.
Yeah, is that, yeah, sure.
Yeah, this is Nikki speaking. I just wanted to know what the signage looks like because I didn't even know that most of these restaurants had ramps that they could provide in the first place.
So when we provided the ramps, we also provided an accessibility toolkit, which had instructions on setting up the ramp, best practices for serving customers with disabilities, and a laminated sign. So it's a sign that has the blue square with the white wheelchair symbol, and then it also has a blank space where restaurants could write their phone numbers for the contact person, so that if you can't get into the restaurant, you can text somebody or call somebody from outside.
Okay, thank you.
Thank you.
Any questions?
Nikki,
have
I'll be
one
happy. Nikki, I'll be happy to email you the actual sign in the email if you write to us an email.
Sure, thanks.
You're welcome. Go ahead, Juan.
Everyone, can you guys hear me? Yes?
Yeah.
Just quick question. Perhaps I missed this part, but are there any also requirements about the sizes of the tables? Because sometimes chairs, especially power chairs, they have different sizes and widths and all of that. And just trying to see if there are also some kind of conversations regarding appropriate space for those kind of chairs.
Patricia, can you answer that one?
Sure. Thank you for the question, Carl. Yes, so as a part of the accessibility kit that we have been distributing to the participating restaurants, there is a description of what we require for restaurant, what the state code required in terms of seating and accessible tables. So they have, underneath the table, there's enough clearance for the legs of a wheelchair user.
Thank you, Patricia.
You're welcome.
In the interest of time, we should just probably move down the agenda if nobody else has any questions.
Looks like it's unanimous. All right, then we go to next agenda. Next presenter is Tasha Ferguson from BEST. Tasha Ferguson?
Yes, I'm here.
Okay, hi. Well, welcome.
Thank you so much, and apologies. Thank you for any flexibility at the beginning of the meeting. I had a little trouble joining for some reason, but was able to make it. So should I go ahead and share the slides and start with the presentation?
Yes, that would be great.
Great.
Tasha, we can see the presentation.
Okay, perfect. Thank you. Okay, so and apologies, I could have perhaps noted this, but you can see now on the screen. I'm going to be presenting today about the Boston Emergency Services team. This is some contact information for both myself and our Assistant Director, Jamie Shorten. And so we would be good contacts if there are questions, concerns, any troubleshooting that might need to occur at any point, and you can feel free to reach out to us either by email or by phone in order to contact us. So just briefly, emergency services programs or providers are responsible for responding to, evaluating, and assessing individuals who are experiencing any form of psychiatric crisis. There is an emergency services program that covers every city and town in Massachusetts. And the ESP for the Boston area is called the Boston Emergency Services Team, or BEST, which is most typically how we're referred to. Boston Medical Center is the lead agency for the BEST team, and we also oversee the emergency services programs that cover Cambridge, Somerville, and Fall River areas. So this is just a slide kind of depicting what our different services look like and are comprised of. The only important thing to note here is that there are the addresses of our urgent care center locations, as well as our CCS programs, and I'll talk more at length about both of those momentarily. And then this is really just to illustrate that we're working with two partner agencies to deliver mobile services into the community, those being North Suffolk Mental Health Association and the Bay Cove Human Services Program. And we have, again, urgent care centers, which are locations where an individual can walk in to receive services in an office-based setting. We have mobile clinicians who go out into the community, including to individuals' homes, apartments, or to areas where other services are provided. And then we have treatment units that we oversee as well, which again, I'll speak to a little bit more momentarily. This slide just illustrates a little bit about, an overview of our services. So again, this is a mobile team, which is meant to respond to psychiatric crises that are occurring in the community. We're staffed by master's level clinicians, typically individuals who are trained in social work or mental health counseling, as well as certified peer specialists and family partners, both of whom are designated individuals who have lived experience engaging in their own behavioral health care or engaging in behavioral health care on behalf of their child. And so we're working in partnership with those individuals to deliver services in the community. We are operational 24/7, 365 days a year, and we can be accessed at any point in time by calling the 800 number, which you see here on this screen. And I can discuss more after, but I'm happy to share these slides with everybody so that you have that for reference. Okay. When our team comes out to provide some service to an individual in the community, we have access not only to the clinician who's specially trained to come out and provide that service in the community, but we're also backed up by several layers actually of supervisory staff, as well as a psychiatrist who's on call to us again 24/7, at all times when we're operational. And those professionals can really assist our clinicians who are out in the community with making sure that we're making the best clinical decision in that moment in time for the individual that we're serving. We also work with several partner emergency departments, and those being Boston Medical Center Emergency Department, Cambridge Hospital Emergency Department, and Mass General's Emergency Department. And, we're working with those facilities in the case that we're meeting with an individual in the community, and it's determined that they may need to go to an emergency department to receive additional care. And so that can be because they're requiring some medical assistance or clearance for placement at a facility, or because we've determined that they're at significant imminent risk to themselves while they're out in the community, and they may need to be transported into the hospital emergency department for ongoing assessment and for safety purposes. So we would use one of those partner emergency departments in that case because we have a special relationship with them, which helps to ease that transition for the individual who's going to be moving from the community to the hospital. And we also may have some access to our web-based electronic medical record, which is your next point here, so that they can see all the information that we've gathered. We can avoid having to ask the same questions over and over again to an individual who might be in crisis. And the other benefit of the electronic medical record that I think it's important to note is that we have stored in this confidential record 18 years of history with our Boston Emergency Services team or any of the other areas that we serve. And so an individual who we're seeing, we can really use that record to help to understand what kind of crises may they have experienced in the past, what has been helpful for them treatment-wise, and it really allows us to serve people, I think, with a little bit more sophistication than if we did not have access to that information. So our mobile clinician who's working on that individual's care at that time has access to those records. And again, if that individual was transported to an emergency department, one of our partner emergency departments, they would also have access to that information. So in terms of the services that we provide, I think the core of what we do is really an assessment to help to determine, in concert with the individual that we're serving, their loved ones, a guardian, if one is in place, if this is a youth or an adult under guardianship, and we're also looking to speak to their other providers who may be involved with the client's permission to try to determine what's happening right now. What were the concerns that brought us into this situation? Again, historically, have there been similar concerns? What has been helpful in those circumstances? Really just to take a full and complete history and try to figure out what the path forward will be. We're also interested in providing some support to the individual in the moment. So not just finding out what's happening for them, but also offering suggestions around coping skills, engaging in some brief problem solving, depending on the nature of the concern, and occasionally offering what we might consider to be some brief therapeutic contact. And that may occur in the moment of the initial crisis, or that may occur as part of a follow-up that we would conduct with that individual to check in, determine if the crisis is ongoing, and make sure that they have the supports that they need. And then finally, we're going to be, we're a very brief intervention type service. And so our goal is, depending on the nature of the circumstances and what the individual is in agreement with, our goal is to then connect them to other ongoing services that are going to provide the appropriate supports in the long term. And so, that can be a variety of different things. And I think there's a slide just a few down from now where we go over some of the potential outcomes, but just generally speaking, that may look like a referral to traditional outpatient treatment, or it could be something as restrictive as, as I note here, helping to facilitate that individual moving to an emergency department, and with the goal of placing them in a locked psychiatric facility, if that's what's needed based on, risk to their own safety or to the safety of the people around them. So lots of options and potential outcomes depending on exactly what the nature of the crisis is for the individual that we're serving. This is just a brief slide to say how one might go about requesting an evaluation from BEST. So again, this is the phone number that was on the previous slide as well, 800-981-HELP. You're going to speak to a master's level clinician during that first phone conversation who's going to take some clinical information about what's occurring, gather demographic information on the individual that we want to serve, where are they, how might we contact them, et cetera. Once we have that information, we're going to then notify the mobile team that covers the area where the individual is. And I want to note here that somebody's town or city of residence is really not an issue at this point in time. If someone is, for instance, in Boston to receive other care, a medical appointment, et cetera, and they are experiencing a psychiatric crisis, then my team would respond. If they were back at home and say they lived in the western part of the state, if they wanted to receive services at the location where they live, then it would be the team that covers that geographic area. So the team that's going to respond in any given point in time is going to be based on where is that individual in the moment when they're experiencing the crisis. And then once the mobile team is notified, then a clinician, our goal is to have a clinician respond within 60 minutes of that call or of the time of readiness. And I want to make that distinction because sometimes an individual might call us to say, I'd like to see a clinician today, I'm experiencing a crisis, I need to arrange for childcare. And so I'd like someone to come and meet me at home after 5 p.m. And although it's difficult for us to guarantee an exact time when someone will arrive, we're certainly happy to work with someone to make sure that we're able to deliver services at a time that is appropriate for them. So this is a listing of the type of information that we're going to be gathering during that first triage conversation. And the information that we're going to be looking for here is this demographic information about the individual that we're concerned about or who would be engaging in the services. So people can often call on their own behalf, but likewise, we get calls from people's loved ones, family members, a provider that they may be engaged with who has some concern. And so for anybody who's calling, this is the information we're going to be looking for about the individual that we would be serving in this case. So all fairly basic And again, really the key thing clinically is what happened, what's causing the concern, and wanting to understand that as specifically as we can, and then to make sure we have contact information so that we can follow up. I won't read everything on this slide, but this is just to demonstrate that we have a couple of different ways in which we can serve an individual, where there's a concern. And so, historically and traditionally, that has been either by a clinician going out into the community, again, to where that person is to receive services there. So someone's home, if it's a youth or someone who's engaged in school, we have the ability to go to the school to provide services. If we're receiving a call from a primary care physician, for instance, about someone who's at that office and there are concerns, we're able to go to that office to provide care. So really anywhere in the community that there can be a safe and appropriate meeting space, we're happy to send a clinician to. Again, traditionally, we also have our urgent care centers, and that was what I've referenced previously about the locations that were on the previous slide. And those are office-based settings, essentially. If somebody's going to come into one of our office-based settings, we do still ask that they call ahead to participate in that triage process that I mentioned. However, people do sometimes walk in without calling, and if they do, then certainly we're happy to serve them once they arrive. Part of the reason we want them to complete a triage, ideally, before they come in, is because sometimes during that process, we may identify that somebody has multiple needs. And so if an individual is experiencing a behavioral health crisis, but also is having a co-occurring medical concern, we would want to make sure that they are going to be seen in a location where both of those can be addressed at once. And our urgent care center locations are non-medical urgent cares. And so, again, just wanting to make sure that all of someone's needs can be appropriately met. It's helpful for them to engage in the triage process before they arrive. And then finally, to highlight something that we've added, really because of the pandemic, although it's something that we certainly plan to continue moving forward, is an option for telehealth. I've noted here, we use a platform called Doxy.me, which we found to be fairly low barrier. You don't need to download an application. We can just send a link directly to the person's smartphone, or we can also send it via email if they're using a tablet or a laptop, some other device. And they just have to click on the link, and then they have access to a secure HIPAA-compliant waiting room. So we've gotten very good feedback on that. I think it's allowed us to really reach people in ways that we had not previously been able to. And so that's been a great option. Again, we're going to plan to continue that moving forward. Okay, and this is just a list of possible outcomes from an evaluation. I think this is not a comprehensive list, let me say. So, just some examples, anything again from really a locked, secure hospitalization, if that's what's required based on safety concerns. And that could include dual diagnosis units for an individual who might also be experiencing a substance use disorder. Our community crisis stabilization unit, which I'll touch on briefly in a moment, and then in-home services, day programs or partial hospitalizations, referrals to outpatient treatment, et cetera. So really, again, any service that we think is going to meet the behavioral health needs that have been identified, we would look to refer someone to that service for ongoing care. This is just a brief example of our alert form, and I just want to touch on this to say that for a provider or a family member or someone else who might have a concern about an individual, they don't believe that that individual needs to be seen immediately for a crisis, i.e. there's no risk or danger today, but we want to sort of put our team on alert that this is someone who may need services in the near future. This would be a way to do that. And so and I can send this electronically as well. But there's an email address on here. This is just a sort of a Word document that you would fill out and copy and paste an email to us. But just pretty straightforward, looking for information about who are any involved providers that we might make contact with if the person does go into some sort of crisis. And just generally, what are the nature of the concerns? So, a really quick example is somebody for whom an anniversary of a loss may be coming up. We know that historically that person tends to go into crisis or experience difficulties around the time of that loss, which would be very common. That's, we're not worried about them today, but over the weekend, when the anniversary of the loss is coming up, we know they might need some care or some response from BEST. And so this would just give us an opportunity to have a little advanced information about that. Providers tend to use this in particular because they can give us some information about the nature of the concern, even if they're not going to be available in real time or at the moment when the evaluation might take place. So I'm happy to go into more detail on that if there are questions after, but this is just to sort of show you that that exists. Okay, and last thing that I wanted to present, and then certainly happy to take any questions afterwards, is our Community Crisis Stabilization Program. And this is a treatment program that we actually run as part of our emergency services programs. It is voluntary, short-term stay, usually about 3 to 5 days. And as I note here, we have 2 different units in the Boston area. The Longwood unit has 7 beds, and the one that's noted here to be Boston BMC has 15 beds. And what it is a therapeutic environment where individuals can come. It's a 24-hour setting, so they would come and stay overnight and receive care there for the full 3 to 5 days that they were admitted with us. And really it's structured similarly to an inpatient unit. So there's daily medication management, psychotherapeutic groups, case management, and really I think it provides a safe therapeutic milieu for someone to stabilize if they're experiencing some increase in symptoms. This is a great opportunity for someone who might need to start or restart medication in a safe place where they can be monitored by staff. I think a real highlight of this facility, as opposed to some inpatient units, is that all of the individuals receiving care at our CCS want to be there, or else they would be able to leave because it is an open unit. And so we find that the groups are very positive. People are really engaged in the care that they're receiving. And it's a great place for us to be able to divert individuals from getting to the point where they may need a more restrictive setting. A couple of quick notes, and something that comes up pretty frequently. We do serve a number of individuals, both through our general mobile team and at the CCS, who are housing insecure or who are homeless. And because of the brevity of the stay, we do try to be really realistic when people come in that access to longer term housing is not going to be an outcome typically of a stay at the CCS. And so, wanting to make sure that we do identify an appropriate shelter setting if that's what is going to be required for an individual, but just trying to be transparent so that people understand, what that might look like. Again, similarly for long-term substance use treatment, people may come to us looking to enter into a 45-day program or a holding bed. We will certainly make all efforts to set that person up to receive that care, but given wait lists and again, the sort of short-term nature of our program, that can be difficult. So we may make an interim plan with those individuals, and then again, try to move them forward in their recovery towards that longer-term placement. And just a note here, anybody who has their medications can certainly bring them with them. If they do not have access to their prescribed medications, we will provide them, sort of within the discretion of our prescribers on the unit. And we're happy to provide cab transportation, or, we use Uber Health now, to make sure that people have access to our setting. Okay, so let me stop sharing. And happy to take any questions.
Thank you. I do have a question. However, I want to first thank you, Tasha, for your presentation, and I want to see if any board members have any questions. Anybody on the board? Juwan, your mic is on. I'm just checking. Do you have a question? Okay. All right, anybody from the public?
Sorry, this is Wes. I actually have a question.
Oh, sure, go ahead.
Okay, so hello, Tasha. Thank you so much for your presentation. I have a question for you. For people who need encouragement or help through BEST, suppose that person is not an English speaker, for example, and they need translation services like American Sign Language or Spanish translation. How do you handle that situation?
Great, thank you, Wesley, for your question. So we use a couple of different means to do so. One, I will say, is that we do employ some bilingual, bicultural staff. And so whenever possible, we would certainly try to facilitate having a staff who speaks the native language of our clients respond to them directly, which obviously has many benefits. In the case that we do not have a staff member working or available at that time, then for spoken language interpretation, we would use our BMC interpreter services, and we're able to have access to them while we're out in the community as well. And so that typically looks like a somewhat messy phone call where we have them on speaker and we're facilitating that conversation with the individual at their home, since we're often in environments where we don't have a more formal, sort of interpreter telephone setup. But certainly the important thing is to make sure that we're providing services where an individual wants to receive them. For individuals who may need ASL interpreters or deaf interpreters, we work either through the Commission for the Deaf and Hard of Hearing, and we would request an interpreter through them. We also work with partners interpreters who we find sometimes are able to be a little bit, we're able to get an interpreter a little more quickly in that circumstance, and given that individuals are in crisis when they're calling us, that sometimes, time is certainly of the essence. And so we would utilize that means to get an interpreter. And then lastly, we have, if an individual comes on site to our urgent care center, we have, and this is, my unprofessional sort of shorthand, but an interpreter on a stick. So we have the sort of, pole with a screen on it where we're able to use the video interpreting that way. And so we would sort of bring that down to our urgent care center to be able to facilitate translation in that manner. So let me be transparent in saying none of this is perfect by any means, especially given that we're delivering services in the community. And so, sometimes we're problem solving in real time, but, recognizing certainly the importance of people being able to express themselves clearly to us, given the nature of our work, and to be able to receive information clearly from us, regarding next steps.
Okay, great. Thank you so much.
Yeah, thank you. Any other board members have a question? No? Okay, anybody from the public maybe?
I have a question.
Sure.
This is Nikki speaking. Is there ever a situation where someone contacts BEST for someone in crisis and the police could get involved?
That's a great question. Our goal certainly is to respond directly to requests for evaluation, and our mobile clinicians don't respond with police. We do have a specific program called our Boston Police Co-Response Program, where we pair master's level clinicians with officers who have volunteered for that assignment. And so in cases where we believe a public safety response might be part of what's necessary, we would, at any occasion where we're able, dispatch one of those paired units so that an officer but also a clinician arrives on scene together to have a paired response in that way, which I think can allow the clinician to take the lead and the officer to take more of a back seat, and really only intervene if there is an imminent safety or public safety related concern. What does happen sometimes is that a third party might call on behalf of an individual. So I call for my roommate and say, I'm very concerned about my roommate. I think that they're experiencing a behavioral health issue, and I would like the best team to come. If my roommate refuses that and says, no, I absolutely will not meet with the best team, I have no intention to talk to them, in that case, we're not able to respond ourselves. And so one of the potential discussions that we would have with the caller in that case is, please call us back. Please continue to encourage your roommate to, interface with us. But if something dangerous happens, the only recourse that we have at this point in time is to direct you to call 911. And in that case, you could get EMS or you could get police and EMS. And so, we want people to have all the information about that. But it is possible that if somebody really refuses to speak to us, that may be a scenario in which police would arrive.
Thank you. Any other people from the public? Not maybe anybody who jumped in? No? All right. I don't see any further questions at this point. Tasha, I just want to say thank you so much for your presentation. I did have a question, however, one of the board members already asked the question, so I'm all set. But I just want to also mention that I just really appreciate what you do. I'm a medical field myself, and even the telehealth part, like just people being able to even use sign language and like all the accommodation that you provide. I just personally am very appreciative of all you do. Thank you so much.
Thank you.
All right, the next on the agenda is the chair's report. However, Kristen, should we skip that for now, for today?
We can see if Elizabeth joined.
Mm-hmm.
Elizabeth, are you on? No, okay. Yeah, we can go to the board report, that's fine. I'm sorry,
Okay.
the commissioner report.
Yeah, all right, Kristen.
Okay, so welcome, everybody. I just wanted to comment on Tasha's presentation to say that May is National Mental Health Awareness Month. So we really appreciate the work that she does and the information that she's shared with the board tonight. So please take that information and share it with your networks. I do have a copy of the presentation, so I'll email it out to everybody tomorrow so that you can share it with anybody who you think would like to receive it. So my first agenda item on my board report is to welcome our new chief of staff. It's a very exciting week for us in the commission. She's sitting next to me. Her name is Andrea, and I'm going to pass the mic to her to let her introduce herself.
Thank you very much, Commissioner. Hi, everyone. As she said, my name is Andrea. Can you hear me all right through the mask? Great, okay. I'm really excited to be back in City Hall, both figuratively and literally. I used to work for Councilor Michelle Wu, and I'm just really glad to be back in local government. I think it's a too often underlooked tool that is absolutely critical to achieving the kinds of policy and really quality of life improvements we all want to see. That said, I've also worked in state government, federal government, campaigns, nonprofit advocacy. I've worked a little on transportation, housing, parks and open space, you name it, I've probably touched it somewhere. But in my professional and academic career, my focus has been on health policy, and that's where a lot of my experience with disability issues has come in, is through that lens of health policy, health access, social determinants of health. Most recently, I completed my Master of Public Policy at Northeastern, working very closely with Dr. Jean McGuire, who I think some of you may know, and really worked very closely with her on health issues, learned more about health and disability issues than I ever thought I would, which is what really inspired me to apply to the position and to join the commission. So I'm really excited to bring my experience to really advance the idea of disability in all policy, make sure everything the city is doing is not only accessible but inclusive. And I'm really excited to help you all do your work and have you help me learn my new job, and hope to meet you all in person as soon as it's safe. Thanks, everyone.
Great, thank you, Andrea, and we're really excited to have Andrea on board. And like she said, she is going to be tasked with working with all of you to move your initiatives forward. And one of the first things I would like to have her work on is the issue of creating the survey for the mayoral candidates. I know we talked about that about 2 months ago now, so I'll have Andrea follow up by email. We're still working to get her fully on the city system, so as soon as she gets her email set up, I'll have her reach out to you about getting the survey out. We do still have a few months until the primary, but time moves quickly, as we know, so that would be something great to have her work on. And on that note, we also had talked about doing the letter to welcome Mayor Kim Janey to her role in the city. And I sent out a draft last month, and hopefully everybody got to look at it. I'm happy to finalize it if everyone's happy with the language. And the only thing I asked is for people to share priorities with me of things that we can put in the letter to call the mayor's attention to. So far I have on the list, I have vaccine equity, I have the captions ordinance, which Wesley suggested, and I have some priorities from my office about bus stops and the new configuration of floating bus stops. But I wanted to use this as an opportunity to ask if any board members have any other priorities they'd like to insert in the letter. Just raise your hand if you have any. Okay, I'll send up a final follow-up email tomorrow, and if I don't hear from anybody, I'll get the letter out to Olivia, and she can email it to Mayor Janey, either late this week or early next week. So just following up on a few other things, the bike plan outreach campaign is in the works. We have 2 different consultants that we're working with to develop. One is developing a toolkit, which will be social media and messaging and branding, and the other consultant is working on a video. So we hope to get those messages starting probably in June. Also, I wanted to let people know that I'm working on a webinar on unemployment for people with disabilities during the pandemic, looking at the positives and the negatives of virtual work to see some opportunities for people with disabilities, but also the drawbacks of the digital divide. So that is happening June 15th, and I'll send out more information closer to that date. Another thing we're working on in my office is planning for ADA Day this year. As you may have heard, the governor's state of emergency will end in June. So we are thinking about ways to celebrate this year. As you all know, we did a celebration virtually last year, and we had several hundred people attend, which was really exciting. So we're trying to think this year about maybe doing a combination of virtual and actual in-person celebrating. And we can't use City Hall Plaza like we usually do because it's under construction, but we're thinking maybe of looking at Copley Square Park, which was the place we had ADA scheduled for last year, which we weren't able to do. So we'll have more information for you coming up about that. And then finally, I just want to let people know 2 more things, that we're continuing to work across city departments for Boston's reopening, both City Hall and with the city itself. A lot of the restrictions are being lifted in the coming weeks, so we want to make sure we pay attention to equity and reopening as far as accessibility is concerned. So we'll keep in touch with you about things that we're working on, but please also keep in touch with us about any concerns you have or initiatives you'd like to see moving forward. And then the final thing that I wanted to note is that the moratorium on the disability parking placards ends on May 31st. Throughout the last year and a half during the pandemic, the Boston Transportation Department has not been enforcing expired parking placards, but they will begin to be enforcing them now. So if you know anyone who has an expired placard, it's really important for them to get it updated before the end of May, when the moratorium will end. And that's it for my report, and I'm happy to take any questions. And then if not, we can move on to the next agenda item. Okay, no questions? That's fine. Oh, somebody have a question? Okay, I'll hand it back to Ducia.
All right, then the next on the agenda is the architecture asset report by Patricia Mendes. Are you there?
Patricia was on, but she was going to be logging off and on, so she'll be back probably in a little while, so we can go to the next item.
The next one is announcements. Anybody have old business to discuss?
This is Carl.
Feel free to step in, Carl.
So I was supposed to have a letter written on the accessibility of vaccination. Is that something the board would still like me to do? Because I can probably do it this week if that's something the board would still like to see done.
Sorry, should I?
Any feedback on that?
So Carl, what stage is the draft at?
I just have to change Elizabeth's wording, and I can do it tomorrow. I don't have any meetings tomorrow, so I can get it done by tomorrow.
I think where the board voted to send it, it's still important to send. You could just,
Okay.
just change the framing to like, instead of actively pursuing it, but looking back and see lessons learned.
Yeah, absolutely. I can do that. Thank you.
Yeah, thank you, Carl.
Another piece of
I think
old
now
business.
the next, Kristen, were you?
I have another old business item.
This is Wes. I have a question.
Sure, Wes.
Sure, this is old business, but I just wanted to check in and see if there's any updates on the captioning ordinance.
Yes, that was going to be my update next. So thank you, Wesley, for asking about that. We did meet with IGR.
Oh, okay, I can wait if it's next, that's fine.
No, that's fine. So we met with Intergovernmental Relations, who is the city office that works between city departments and city council staff. And they asked us to wait to submit the request for the hearing because the city council is really tied up with budget meetings right now. And they're actually only scheduling budget meetings for the last month and probably the next month because the budget has to be passed, I believe, before the end of June. So I know that city departments have been going for hearings and working really hard on that, especially with the pandemic. Funding is really more complex than it's been in previous years. But one suggestion they had was to work on all the issues that we want to work out until the budget season's over, and then maybe have the mayor announce it in preparation for ADA Day, and then we can do a big social media launch and a big push out for ADA Day, making this an issue of equity with reopening. Because by that time, the restaurants should be up and running and hopefully have their systems in place with outdoor dining, and they'll have more time to digest the requirement and put it into place.
Okay, great. Thank you so much. I think that around ADA Day would be perfect. That would be perfect timing to get that going.
This is Carl. I have something to add to that if you don't mind.
Oh.
So I also wrote a bill along with Senator Barrett that has been submitted, and I will let the community know when it goes up for hearing, but very similar to the one that Boston's looking at. And so that will be a bill for statewide, hopefully in the next few months, that bill will be heard, and I will let the community know when.
I also wanted to ask if you could possibly give an update on the broadband program that was launched recently?
Oh, with the FCC?
Yes.
Yeah, so the FCC, one of their concerns is access to broadband for people of all backgrounds, whether it be race, gender, income level and people with disabilities. The one thing that the pandemic has shown that access to broadband is a need, no longer nice to have, but it's a need because it gives you access to education, employment, and healthcare, and many aspects of life. So the FCC has launched a program where you can apply for funding if you meet certain income eligibility guidelines to help pay for access to broadband. They're also mapping the whole country to see where there is broadband and where there isn't, and thinking about long-term putting some priorities and funding to increasing broadband and infrastructure in conjunction with the Biden package, the infrastructure package to improve broadband in areas that don't have it. So, but the good news is, first of all, for those who can't afford broadband or who need access, the FCC at www.fcc.gov does have a program where you can apply for financial assistance to acquire broadband or internet access if you need it.
Thank you, Carl. I think that's all for old business.
All right, okay. Is there any new business?
This is Carl.
Carl?
I'm sorry, hey, you know me. I would like to suggest that Andrea, in her new role as Chief of Staff, maybe try to set up a monthly meeting with the executive team of this committee or commission so that we can work on things between meetings. And she can help us to keep focused on tasks and items and things like that. So that's something I would like to suggest that she work with the executive team on as we move forward.
I love that, Carl. I am all about that. As soon as I have my official email, I will get an email out and we'll see what we can get on the calendar.
Okay.
Great, and I had one item I wanted to bring up too. Along with the letter to Mayor Janey, I wanted to suggest that the board send a welcome letter to Secretary Walsh as Secretary of the Department of Labor, welcoming him to his new role and also outlining priorities. It can be very similar to Mayor Janey's letter. I can use the same body and type out a draft, but the priorities may be a little different. I do have some suggestions for priorities because what Secretary Walsh will be working on at the Department of Labor will be more specific to employment, and there is a lot we can talk about as far as disability employment. I know Wesley had sent a response to that email talking about employment figures for people who are deaf, which we really need to work on, so I think we need to put that on Secretary Walsh's radar, and I just wanted to raise the issue to see if anybody wants to call for a vote, if you'd like to do it, and I'm happy to help with that.
I call for a motion.
I second.
I third.
All right, now you have to call for the vote.
Oh, yes, I apologize, yes. Anybody wants to add A or nay? Anyone wants to, okay, raise your hand if you go with A.
Oh, A.
All right.
People can
Any
raise
A's?
their hand or say aye.
Okay, yeah, aye, sorry. Okay, all in favor?
Aye.
Aye.
All right. Okay.
Should we also make a motion for the mayor, welcoming the new mayor? I don't remember if we ever did that.
We did, we voted on it 2 months ago,
Thank you.
or last month.
All right, so motion's accepted. Welcome, Elizabeth. Glad that you're here.
Oh, thanks. It's always, that's what executive boards are for, that I'm glad that you're being very capably chaired tonight.
Thank you. All right. The next, we just have public input. Anything from the public?
Hi there. Am
Hello.
I going to be okay? This is David Vieira.
Welcome, David.
Am I coming through?
Yes,
Hi,
I can hear you.
So I'm down on the dock at Community Boating right now, enjoying the sunset. And this is the first time the Blind Sailing Group has come down to the boat club for a practice. And the only reason why I'm not out on the water is because I'm recovering from a little minor surgery. So I am the designated guide dog sitter while all the other folks are out on the water tonight. But I just wanted to expand on Carl's points about the FCC program and the broadband subsidy. It is a subsidy, and it's for $50. It does not go directly to the consumer. It's a credit against your broadband bill. I just wanted to make that clear so that people
Thank you,
will
David.
know what it's about. Am I correct on that, Carl?
Yes.
Okay. And thank you for being here, and that's all I have to say this evening.
Which guide dog are you sitting for?
I'm sitting for all of them.
Okay, I think I know all about them.
There are usually 3 or 4 of our members that come down with dogs, and I'm the designated guide dog sitter tonight, but I don't have a lot of dogs with me this evening. Most of the people with guide dogs did not show up, so I've got an easy night ahead of me. Everybody's out on the water right now. They'll be coming in soon. So, thanks, everybody.
Thanks, David. And Ducia, if you want to call for any other public input, and then we can see if Patricia is back on. Patricia?
Absolutely. Yes, anybody else on the call that would like to share something with the public? Okay, there's nobody. Is Patricia, are you there?
She just texted she'll be on in 3 minutes. So if we can wait a few
Okay.
minutes, it's 5 minutes a set.
Sure.
She's gonna deny me of making the motion to adjourn?
We'll just give her a few minutes, and if she's not back, we can, you can make the motion.
I'm kidding, we can wait 3 minutes.
I know you're kidding.
I didn't realize, by the way, that just the timing of all the variables and the transportation, that it was already at this portion of the meeting. But it just was going to be too disruptive to try to do it by phone. But thanks, everyone. I'll look forward to reading the minutes.
Since you just joined, Elizabeth, is there anything that you wanted to add or update or speak about?
Well, for the letter we were going to write to the governor and Secretary Sedgwick, Carl, I don't believe I heard anything from you. Is that correct? Is there?
About what? I didn't hear what you were just saying.
I think when we last left off about a letter,
We discussed that. One is coming.
Okay, great. I just want to make sure folks know that that's where we left off in the process. Okay, great.
We left off that I haven't done my responsibility yet.
Well, and obviously it's a changed picture in some respects, but I think for going forward, it's not only a complaint about a one-time event.
No. Don't worry, we're fine.
Great. Well, I think it still has utility, as does indicating things that have, how Boston has handled itself.
Thank you.
And I see Patricia has joined, if you want to introduce her, Ducia?
Yes, hello, Patricia. Thankfully you rejoined. Would you mind showing the architecture access updates, please?
Carl. He's so funny.
Great, thank you. Hi, everyone. So happy to be back here. Last year, we stopped doing the architectural access updates, but I'm back now. I've been here the whole time, just not doing the architectural access, commissioner was filling you guys in. I have a couple of announcements, a couple of civic engagement opportunities that I want to share with everyone. The first one, well, first let me just say my name. My name is Patricia Mendez, Director of Architectural Access for the Boston Commission for Persons with Disabilities. I have a couple of civic engagement, as I said, opportunities. The first one comes from the MBTA. They're having a public meeting coming up, and I'm going to also include the links in the chat and in the notes. Actually, Sarah's going to help me do that. Thank you, Sarah. The first MBTA public meeting is going to be about the fare rule changes coming up in the upcoming years. The dates are on May 25 and the 27th.
Break.
I'm going to also share a phone number for the contact person. The contact liaison is Terry Chan, and her phone number is 617-645-0614. The next one is another virtual public meeting on June 8th, and this one is about the bus network redesign. The meeting in June 8th is at 6 p.m. And we're sharing the link also in the chat. And this will be in the notes as well. One more announcement, and this one comes from the H Strong Commission, and is an application for the Senior Charlie Card. And this program is for older adults, and it's a discounted Charlie Card. And I'm going to share a phone number. Is 617-222-3200. You can call that for renewal and for application. Again, 617-222-3200.
Elizabeth D-Clover says in chat, colon I have.
Somebody has a question, but I'm gonna finish the report and then I'm gonna open it up for question, if that's okay.
We told you about Elizabeth's questions.
Okay.
Yes, go ahead, Fish.
Thank you. It's not gonna be long. I promise. The next one is about the Massachusetts Architectural Access Board. As you may remember, I continue to serve as a member. And now the director, William Joyce, has hired 2 people, so he's fully staffed. The two new persons' names, one is Mark Lesser and the other is Bradley Sodders. So he is now fully staffed. They're all wonderful. The board has the Architectural Access Board has elected a new chairperson. Her name is Dawn Guariello, and has elected a new vice chair. I'm happy to say that I was elected vice chairperson. The next one is my participation in the CODA group. CODA stands for Commissions on Disability Alliance, which is a group that meets every month. We used to meet over the phone, now it's a Zoom, and the participants are the neighboring municipalities, usually Cambridge, Brookline, Newton, Acton, Braintree, and more. We talk about things that are relevant to commissioners, to give support and to share resources. Some of the municipalities haven't been meeting regularly, and And having accessibility to meetings has been, a hot topic, as well as pandemic issues, vaccination, and food access and food insecurity. The next one is, this one is exciting. The DPW, Department of Public Works, is planning a reconstruction of the Beacon Street portion. This is right in front of the State House and right in front of the Shaw Memorial. And that includes the street, the pedestrian crossings, and the sidewalk. So we're very excited to collaborate with Public Works and to coordinate with the other projects in the area, which is the Shaw Memorial and the State House sidewalk.
The Beacon Hill Access Architectural Commission is actually having a meeting on that tomorrow at 5 o'clock.
5 o'clock tomorrow.
Yep.
Thank you, Carl.
We can send all the we can send all this information out in an email tomorrow.
Okay, great. I will. Thank you, Commissioner. One more thing, two more quick things, and then I'm done. Rosendale Square sidewalk reconstruction, which is a partnership between the MBTA and the City of Boston. They are reconstructing part of the sidewalk and they're installing an accessible bus stop. This is in Washington Street and Poplar Street in Rosendale. And the project is going to improve a couple of entries of the businesses that they're going to achieve a flash entry. So we're very excited about that collaboration, that partnership. Last one, Columbus Avenue is going to get some new pedestrian ramps as part of the big project in that area that includes a bus lane, which is under construction right now. And this is in the area of Eggleston Square by the fire station. And that concludes my report, and I'm happy to take questions.
Thank you very much, Patricia. Elizabeth, I remember you had a question.
Yes, actually, because Kristen had asked prior to that if I had any update, I'll congratulate you on your advancement on the Access Board. But actually, it wasn't a question in general. I just wanted to, I called it a question, but I just wanted to give people a quick update from the ride, if that wasn't already covered earlier. But let's stay with Patricia's, any questions for her. But just before the meeting, before Carl has the adjournment ready to go, that's the little piece I was trying to make sure I fit in.
Thank you, Elizabeth. I'll pass it to you when I'm done with answering questions.
Yeah, thank you. Thank you as well, and congratulations from me as well, Patricia.
Thank you.
You're welcome. Any questions from other board members? Carl? Okay.
I'm ready to make the motion, but didn't Elizabeth want to give an update on the ride?
I just want to add one thing. The CODA calls that Patricia mentioned, the Commission on Disability Alliance, or Committee on Disability Alliance, those meetings are among all the disability commissions in neighboring towns, like Patricia said, and you're all welcome to join. I don't know if we've ever invited you before, but the commissioners who have similar jobs to you, they're the ones who meet every month. So we'll send that information out too. It's a Zoom meeting once a month, and they're really informative, and it's a good opportunity to make connections with other cities and towns.
Could you send us the link every month so that we know to join?
Yes, we can.
Okay, thank you.
Is it a standing meeting at the time?
It is. It's a Wednesday at noon. I think it's the first Wednesday of the month. I'm happy to share the calendar invite.
Sure.
All right, is there any questions from the public? Anybody on the call?
Hi.
Davey.
Yeah?
Oh, go
David?
ahead.
No, you go ahead.
I just wanted to ask Patricia, when they set up those meetings with the Public Works Department for the Beacon Hill makeover, tell them to mix the bricks. That's all.
Hi, David. Nice to hear
Hi.
from you. Hi.
Nice.
Yes, so we're paying attention to the brick, and there are also other groups that are paying close attention to the brick. We're having the areas that had brick before, they're going to have again brick, but this time it's going to be the wire cut. And the new areas that didn't have brick, well, they didn't have a sidewalk at all. Those are going to be concrete on the park side.
Well, I think I may have mentioned this on the subject of bricks 2 or 3 years ago, but if you want to go over to the Federal Reserve Plaza across from South Station, they have a very nice brick-looking plaza that is not brick. And it doesn't act like brick, and it doesn't pop like brick. And it's really a nice alternative to our old brick landscape. And I know all of the arguments about, you know, Boston is a brick town, and Tom Menino found Boston brick and he left it brickier. So I'm not an opponent of brick, but when it gets to the point where people are hurting themselves and the bricks are not being properly replaced when they pop, it's a public safety concern. So there are alternatives out there, and if the Beacon Hill Historic folks have a problem, like they did with the curb cuts, there really needs to be a compromise on public safety over historic preservation.
Yes, David, I agree. We're paying close attention, and we are involved in those kind of conversations all the time.
I know you are. I'm sure you are.
I'm happy to go take a look at the area in front of Federal Building. I'll actually try to go in person.
Yeah, it's a very interesting treatment, and it's been there for years and years, and there's never been a problem with that plaza, and it looks really nice.
Thank you, David.
It looks like
Thank you,
Sarah,
Patricia, for everything.
I know Carl and, I know Carl and
Yes.
Paul had, and I know Nikita had a question.
I think Sarah wants to comment on the brick.
Okay.
I just had a comment
Yes.
on Joy Street from the African American Museum all the way down. It's a cut brick, historic looking, flat surface brick that I know at the time Mayor Walsh and, well, now U.S. Labor Secretary Walsh was adamant about making that possible, and what I have nothing but strong reviews, and it also forms right in with the road. The curb is all at the same level, and it still looks very historic. It's a flat cut brick. If you ever want to, David, take a walk over, goes all the way down Joy Street. Patricia, if you ever want to take a look, I think we mentioned this at a meeting about a year ago now. We had this discussion, but it is worth checking out. We had this discussion when they were putting the brick in for the restoration of the City Hall Plaza, and it's the same type of brick. It's historic looking, yet it's a flat surface, original format. So I've heard and actually firsthand walked on, witnessed, helped people in carts, wheelchairs, with all sorts of mental disabilities on this type of sidewalk, and it's been very accessible. Thank
you, Paul. Yes, you're right. Public Works has a very good detail that has an underlayment of concrete that helps make the bricks stable and not move up and down or side to side. And the joints are tight.
Yes. It's just worth looking at. It's a nice option. It still looks presentable and historic. It's definitely worth checking out.
Will do.
Hey, any other board members? Carl, did you have do you have a question or a comment for Patricia?
No.
All right. From the public?
Hi, this is Nikki speaking. I just had a general question. This is the first meeting I've attended, and is there an email list for this committee, or is it just for the board members?
I can give you my email. It's very easy to remember. It's ada@boston.gov.
Nikki, if you visit our website, you can sign up for our weekly email newsletter, and you can find that at boston.gov/disability. And we do a weekly newsletter with information on what's happening in the city that will be relevant to people who are interested in disability issues. And we always advertise our meetings on in our newsletter. And we also, we do meet once a month, public meetings, and you're welcome to join in.
Great, thank you.
If you'd like to email disability@boston.gov, we can send you any links that you need.
Sounds good.
All right, is there any other questions or comments from the public? Anybody wants to add anything? Oh, yes,
I just want
Patricia?
to say to Alice, it's nice to meet you and welcome. Thank you.
Okay, you know what I'm gonna say next.
No,
Yes.
don't.
All right, do you want to do anybody wants to start a motion to adjourn?
No. Elizabeth.
Elizabeth has to do her update.
This is very quick. We just want to, I just want to inform the board and any members of the public. They might have already received information through other channels, but just to cover all of them, the beginning next week, the 24th of May, that the ride program, the ride vans, will become ride sharing vans did you already go over this in the earlier part? If not, then consider this another source of that information, and there should be blast emails and other ways that information is coming out. But also for those who are interested in the what's been the ride pilot, that the additional 2 rides that were added on primarily to help facilitate people's travel to and from vaccine centers, but not exclusively. Those additional 2 rides will continue through the end of July. And we hope to have additional updates from the MBTA ride office soon about other measures that will be forthcoming or longer term plans for the pilot program. But as of just meeting with them, a general meeting yesterday, that information was not yet available. So we continue on the Riders Transportation Access Group Board to continue to try to press for these transportation issues and accessibility on the behalf of the disability community, both for the paratransit programs, the ride and the Uber and Lyft programs, as well as the fixed routes. So that's what I know as of now. Thank you. Now you're muted, Dawson.
Oh my gosh, sorry, my internet keeps acting up. Okay, now, Carl, I guess now we can, this is your favorite part, motion to adjourn.
Oh, what makes you think I want to make a motion to adjourn? No, all kidding aside, first of all, before I make the motion to adjourn, I would like to say, Bucia, you did a great job tonight.
Great job.
And now I would like to make a motion to adjourn.
A second.
Good, all in favor?
Aye.
All right, motion adjourned. I'm the meeting.